Good afternoon, everyone. Myself, Dr. Kirti, Assistant Professor, Physiotherapy Department. So today, I'm going to tell you about respiratory system and mechanics of breathing. Respiratory system include the lung, the conducting airways, which direct air to the alveoli, and certain parts of the central nervous system, chest wall muscles, and diaphragm, which are responsible for inflation and deflation of lungs. So basically, we are having few muscles of inspiration and expiration. The prime movers of inspiration are external intercostal and diaphragm, and accessory are sternocleidomastoid, scalene, and pectoralis minor. And expiration, which is we can say it is a passive process, and along with the diaphragm movement, there is also an active breathing, which include the internal intercostal, abdominals, and quadratus lumborum. So breathing is an involuntary process which involves inspiration and expiration, and two processes involve bone and muscles. And an average, the breathing rate of an adult is 12 to 14 breaths per minute. Inspiration is an active process in which the thoracic cavity expands, pleural cavity pressure decreases. There is movement of rib outward and upward, that is rib movement. There is also descent of diaphragm, and due to these movement the volume inside lung increases, which further decreases the pressure inside the lungs. Also, the decrease in pressure in lungs relative to atmospheric pressure leads to movement of air from atmosphere to the lungs. Rib movement: the first pair of rib moves and bring about increase in anteroposterior diameter. Second to sixth ribs slope downward and forward from their joint with spinal column, that is pump handle movement. And 7 to 10th rib swing outward and upward, that is bucket handle movement. So in this there is a bucket handle movement shown, and the movement usually come from lower portion due to cartilage as well as shape of ribs, and lower ribs are shaped in direction of movement, upper are horizontal. And in this pump handle motion is shown, which is less flexible, and also it increases the size of cavity from upper chest, that is from sternum. Then next we are having the diaphragmatic movement, which is responsible for 75% of inspiratory effort. Thin dome-shaped muscle which is attached to lower ribs, diaphragm process, and lumbar vertebra, and it is innervated by the phrenic nerve. And during contraction of the diaphragm, the abdominal contents force downward and forward, which increase the vertical dimension of chest cavity. Rib margins are lifted and moved. Diaphragm moves down 1 centimeter, and during forced inspiration, diaphragm can move down 10 centimeter. So in this figure, the at rest, usually the diaphragm is relaxed, and when the thoracic volume increases, it contracts, and then again, when the volume decreases, it again relaxes. Expiration, which is the passive phase of breathing cycle, and in this phase the chest and diaphragm relax. Last, there is elastic recoil of thorax and lungs return to equilibrium, and active expiration requires abdominal and internal intercostal muscle contraction. Rectus abdominis, abdominal oblique muscles, internal intercostal and accessory muscles like adductor muscles or vocal cord, but their contraction is not complete. The main function is basically protective. So in this way, inspiration, expiration usually occur. So in inspiration, like there is diaphragmatic contraction, elevation of rib cage, increased vertical diameter, epidiameter, external intercostal contraction, but internal intercostal relaxed. And during expiration, there is contraction of abdominal and internal intercostals. So thank you.